Welcome to my podcast. Today I will talk you through confusion and dementia. So basically in this station you will find an elderly man who have been confused, and you need to find out if it's sudden or not sudden or gradual. So if it's sudden, it's called delirium, as we might know. So in this condition, the patient won't be able to think, can't speak clearly, struggle to remember things, and sometimes they might see or hear things that not real. So it could be short term, whereby they can't remember things in a few seconds, or it could be long term, whereby they can't remember, for instance, an example like their house color, neighbor name, and it could last for a long time. So what could be the reason for basically delirium, which is acute condition or a sudden onset? So it could be sepsis, which is one of the important things in elderly. I mean by that, it could be UTI, it could be pneumonia, and sometimes it could be if an elderly had constipation for a long time, so for instance, few days, it could cause urinary retention, which could lead to UTI. Also, other causes could be transient ischemic attack or cardiocerebral accident if there is history of head injury, and also it could be related in acute state to hypoglycemia or alcoholism. Other causes could be medication or uses of illicit drug. For dementia, basically, it's not a disease in itself, it's a collective of symptoms, and it progresses over time with memory loss. So in those type of condition, you'll find that the mental function is altered. There's trouble concentration, there is forgetfulness, memory loss. So basically, if the patient go out or around the home, they get lost, they can't find their way back. They won't be able to concentrate or think. Also struggle to follow a chat or find words. They have problems in speaking up. Their mood can be changed, can't recognize loved ones. They might ask certain questions repeatedly, and they become withdrawal, agitated, find it hard to find words or communicate with others. They might lose their appetite, lose weight. They might have issue with the movement around. So basically, they will have all of that. You need also to inquire about any history of trauma, if there is any history of chronic illness, if there is history of medication intake on the long run, if there is history of fall as well, if there is any past medical history, if there is family history, for instance, of Alzheimer or vascular dementia. Also, you need to inquire about alcohol intake, which could lead to, in delirium, it could lead to hypoglycemia, dehydration. So all of that should be put in mind. You need to ask about allergy as well. That shouldn't be missed. And also, after you have done all of that, you will examine the patient, ensure a chaperone with you, and check the observation. I mean by that blood pressure, pulse rate, temperature, respiratory rate. If you find anything doesn't seem right, you will treat accordingly. And then you progress according to the case scenario. So by that, I hope that I briefed you about delirium, which is a sudden onset, and dementia, because both they overlap with each other, and you could tackle both case scenario by those questions to find out the actual cause for this old man deranged situation or changed behavior. Thank you.